Good evening. Hello, hello, hello. Hello, hello. Clap your hands if you hear me once. Clap your hands if you hear me twice. Woo, all right. This is a great group. Listen, my name is Angela L. Young. I always say the L because the name of my business is ALY Media Relations, but I'm on the campaign trail for Helena Moreno for mayor. Woo! I am so excited to be amongst friends, women, the people who get it done, right? Woo! Thank you so much for coming. We need all of our panelists. If you're not already, this section right here is reserved for our panelists. So we need our panelists to come and sit in your seats. And then I have the honor of introducing someone that I don't see in the room. I don't know if she's in the back or not. And I'm not a good singer. So, anybody want to come and tell a good Helena Moreno story? Let's see. I'm going to put somebody on the spot. No, it needs to be a female. Okay. Yes, ma'am. Right here in the blue. Somebody pointed you out. Somebody pointed you out. Come on up and introduce yourself. I've always wanted to be a game show host, right, Mom? Come on up. Tell us your name.
My name is Charmaine Cassiope, and I've had the honor and the privilege of working professionally in a capacity that has allowed me the grace to not only get to know, but to work intimately with the one and only Helena Moreno. I have to be honest with you, my professional career allows me to do lobbying. And when my life was transformed by a tragedy, because my best friend, one of my best friends growing up, was murdered by her estranged son-in-law. And I had to try to make sense of that situation. And so I went to Helena Moreno, along with a dear friend of mine who is a gifted and talented attorney, Kim Sport. And we asked her to be our champion in the state legislature. And I want you to know, because of her courage, and because of her determination, and because of her strength to defend the principles that we all hold dear. Your home is a sacred and blessed environment, and it should be protected. It should never be a place where you experience harm or that kind of tragedy. And so I want you to know that because of Helena Moreno, we made history in Louisiana. We passed in 2014 the most comprehensive package of domestic violence legislation in Louisiana's history. And I am forever grateful, because in a horrific situation like that, she made it possible for us to know that as horrible as that situation is, my friend never died in vain, because we are saving lives across Louisiana because of her. Helena's the woman.
Let's give it up. Oh my God. What a moment. And it was so impromptu. Thank your friend in the green who pointed you out. It was so perfect, right? So now I have the honor of doing really what I was supposed to be up here doing, not being a game show host by practice, of introducing someone who is also a champion for women in the state of Louisiana. She is going to be the moderator of our first panel, and she's no stranger to you, but I'll just say that I'm going to introduce her to some and present her to others. Let's bring up State Representative Mandy Landry.
Thanks, Angela. Thank you. I feel like that's clapping for everything we've had to deal with this year up there. A lot of familiar faces in here, but a lot of y'all have known me since 2019. Hey, Miss Linda, #1 fan. When I ran for office, in part on a platform of women's health issues, whether it was abortion or maternal health care or child health care, it was needed at the time. But anyway, we are here tonight. We have a lot of medical professionals. I have to use notes tonight. Advocates, community leaders, people I see in Baton Rouge, people I see in the district. Everyone here recognizing that women's health care right now is possibly more at risk than it ever has been. We thought the bottom fell out in 2022 when Roe was overturned. It's just getting worse. We were just talking in the green room about Medicaid money getting cut, about public health centers getting cut. It is really a dire situation right now. And in a city like New Orleans, where so many people are not doing well financially, we're a majority black city, we have a ton of young people here, that is going to be felt here more than other places. I am glad we have a candidate who has worked on women's health issues from maternal health and reproductive health to domestic violence for 2 decades now, I think. And so I'm happy to be here. I'm happy to introduce her, and let's move to our panels in a few minutes. Council member.
Look at this crowd. All right. Well, good evening. I'm Helena Moreno, and as you all know, I'm running for mayor of the city of New Orleans. And I am so proud to have now more than 2,000 members of Women for Helena. That is unbelievable. And as you all know, for quite some time now, I've had such a strong focus on women's issues because I've seen that there's been such a void on real focus on women's issues. And, you know, obviously seeing Charmaine here, and I know that she spoke to you all earlier, but when I first entered back in 2010, the Louisiana legislature, you know, I really expected to be working on kind of the more typical things like obviously education and public safety and things like that. But when I got to the Louisiana legislature, and Mandy, I'm sure you still see this, I saw that there was such a void on real focus on issues that predominantly impact women. And that is when then I learned so much about the issues of domestic violence here in the city of New Orleans and really throughout the state of Louisiana, and understood the need for additional protections, which of course we fought for and we won. And then the following year, I actually met Morgan Lamondre, who's with us today, and she is with STAR and advocates for victims of sexual assault. And that is when I realized that all across the state, victims of sexual assault were actually being treated differently. And there were some parishes, one in particular that I'll never forget, where there were discussions about what a rape kit included. And in one parish, a rape kit was a pregnancy test. And so that year, myself and actually now Councilmember Morell, we worked diligently and very hard in really revamping how victims of sexual assault are treated all across the state, and also how we have consistent funding streams to pay for forensic medical exams, which are the rape kits. And the way that we did this, okay, I'm gonna tell this one quick story, because it is a funny and weird story. Okay, so Charmaine has me go to Opelousas, Louisiana, to speak on domestic violence and some of the legislation that we passed. So we go to Opelousas, Louisiana, and I speak at this luncheon, but there was also this new track in Opelousas, Louisiana, racetrack. And as you all know, I like horses and racetracks, and I said, let's go check it out real quick. So we go check it out, and you know, I decide, let me just go play a slot machine real quick. I play a slot machine. And she won. And I won. Yeah, Michelle, I won. So then, as I'm trying to figure out how we're going to have this consistent stream of revenue to pay for forensic medical exams, I go, wait, like, Charmaine, what do we do with the money? Like, let's say if I were never to cash that ticket, what happens with that money? And we were like, we don't know. So at that time, I needed $3 million every year to pay for the forensic medical exams. So I called the head of the gaming board. I go, hey, what happens to that money if you never use those racing tickets, or you never turn in your slot ticket? And the gaming chair goes, oh, that just goes straight back to the casinos. I go, what? And he goes, yeah, it's really weird because other states take that money and they use it for necessary causes. So that's how I ended up going to the state legislature, changing that law, and that is how we now pay for forensic medical exams in the state of Louisiana. It's just funny how things happen and really how God works. You know, he brings you solutions. And so I'll say this, you know, as mayor, I will continue to, of course, always be an advocate for women and protect women, but this is a very tricky and difficult time, particularly when it comes to women's health care, reproductive rights. No doubt about that. That is under attack from the very top to, of course, the state level as well. And so often people say that cities can't do anything about it. Well, I have Dr. Jennifer Avegno here, who's head of the health department, who I can tell you that every day is working to do something about it. From the fact that she pushed forward here in the city of New Orleans a study that will be looking into the impacts of now the fact that critical medication and misoprostol and misoprostol, the fact that that is now being prescribed and the impacts of that. But I also want to tell you when Dobbs came down, when that ruling came down, that Dr. Avegno and I were on the phone with the White House. We were on the phone with different organizations trying to figure out options. And I'll tell you this too, that strong leadership can say, hey, you've got these very heavy-handed restrictions and overall punitive criminal implications on our doctors. But myself as a leader of the city, I can say, NOPD, you don't have time for that. And that is when strong city leaders matter. And there's always a way that we can figure out this path and work with others around the country in other states to find out a way to push back for those who are trying to come up and really threaten the lives of women in the state of Louisiana and right here in the city of New Orleans. So know you'll always have that in me. Tonight we have a really great, really two panels. We have two really great panels with just giving you kind of a lay of the land of where we are with certain issues and ways that you can also help, which I think is so important. But more than anything, just thank you all so much for being here. Thank you for supporting me as a candidate, supporting me as a woman, and for supporting women here in the city of New Orleans. Thank you all so much. God bless y'all.
Hello again, everyone. Our first panel is going to be specifically on women's health care, but the whole spectrum, from being pregnant, from being a mother to cancer survivors, everything that you will face throughout your life, because we know while it's stressful when we start as a teenager and we don't know what's going on, little do we know that there's so much more to come. And again, in a city like this, we face a lot that maybe other larger richer cities don't face. But I would like to ask my panelists before I introduce you, as we were talking in the green room about policy being political, women's bodies have been abused and used by politicians, by everyone down from the president to people in this city who run for office. And that is not just unfair, it's harmful to all of society. So I'd like y'all to tell me a little bit, when you answer the questions, the barriers you faced in getting someone to just listen. Dr. Gillespie, when you go up and want money, let me tell you why I need money on this. And then how you maybe approached it. So I'm gonna introduce our panelists. I'm gonna go one by one, and then we're gonna get to some questions. Dr. Veronica Gillespie, you have probably seen her in the news lately. She is busy. She's one of our most respected advocates in Baton Rouge. She is a board-certified obstetrician and gynecologist and an associate professor at Ochsner. She also serves as the System Medical Director of Health Outcomes and Medical Director of Quality for Women's Services. She has many state-level and national positions focused on improving birth outcomes and eliminating racial disparities in maternal health. She's testified before Congress, led congressional briefings recently, I think, and was an invited speaker at the White House Maternal Health Day of Action, where she advocated for policy improvements. And my little note for Dr. Gillespie, 4 years ago, a nobody state rep who didn't know what she was doing somehow got put in touch with her, and I said, I heard about this program that the Biden administration is doing that we can extend Medicaid for a year to 100% of women. Is this something you'd want to do? And you kind of like freaked out. You're like, wait a minute, did this just happen? It had just come down the chain. And it took a whole bunch of us, including Senator Peterson, and we got that through, and we were the first state to do that. So I have been very impressed with all of your help in Baton Rouge. Next is Dr. Takesha Davis. Dr. Davis is a daughter, mother, and sister who was born and raised in New Orleans and educated at Xavier University of Louisiana, Johns Hopkins, and the Harvard School of Public Health. In 2005, Dr. Davis returned to the Louisiana Department of Health, where she served in various positions, including the director of the Center for Community and Preventive Health, Office of Public Health Medical Director, and the Assistant State Health Officer. She currently serves as the president and CEO of the New Orleans East Hospital. At that hospital, Dr. Davis is committed to reducing disparities in health outcomes and promoting health equity by focusing on evidence-based clinical and population health initiatives. Thanks, Dr. Davis. Dr. Blanton. Dr. Elizabeth Blanton has been caring for women on the West Bank for over 20 years. She's passionate about providing compassionate care and has dedicated her career to improving women's health. Dr. Blanton currently serves as chair of the Women's Health for LCMC, helping guide women's services across 8 hospitals. She's also the medical director and managing partner at the Women's Medical Center in Gretna, where she sees patients and leads a practice focused on full-spectrum women's care. She's board certified in both OBGYN and clinical informatics, and she brings together hands-on experience and smart use of technology to make healthcare better for everyone. Thank you, Dr. Blanton. And last but not least, new friend, Erin Stevens, who is the executive director of Ellie Mental Health. She's a licensed professional counselor supervisor with over 15 years of experience in mental health. Originally from Ohio, she earned a master's in infant mental health counseling psychology from Chatham University before relocating to New Orleans in 2014. She serves as the executive director of Ellie Mental Health and oversees clinics across Louisiana and Mississippi with a focus on trauma-informed care, mental health advocacy, and community partnerships. She also serves on the Community Advisory Board for Family Connects New Orleans, a program that connects families, clinicians, and community agencies to support healthy infant development. Thank you, Ms. Are you Dr.? Ms. Stevens. We have a very, very educated, experienced panel up here, and I expect to see them all in Baton Rouge next year. Also, if any of you have any husbands or fathers who are very old white men who want to come testify, they are always welcome, because that's who I serve with. It's literally, that's who's around us. So anyway, we can just get them to go up and say, I agree. Dr. Bell, can you tell us about the biggest health concerns for women in New Orleans and why some of those concerns are unique to this city, how poverty and housing affect those issues, and how you've been trying to navigate for your patients?
Yeah, so thank you so much for allowing me to be here. Thank you for the question. So I see lots of concerns from the patients that I take care of and in the communities that I serve. One of the biggest concerns for our women that are of reproductive age is, am I going to have a healthy pregnancy? Am I going to have a healthy baby? Louisiana right now ranks 5th in maternal mortality, and we received a grade F for our preterm birth rate yet again from the March of Dimes. And there are a lot of great efforts and a lot of things that are happening to help improve some of our maternal outcomes, but it's still a concern, it's still a fear, especially when we talk about disparities. When we talk about disparities nationally, we talk about disparities from the state level, especially with maternal mortality, infant mortality, for our Black and brown patients, they suffer much more. And so those are the biggest concerns I see for our women of reproductive age. For our women that are also reproductive age, but also transitioning to perimenopause and menopause, the biggest concern I see is the lack of information. We have not had financial money, we've not had money dedicated to really research issues that only affect women, things like fibroids, endometriosis, polycystic ovarian syndrome, perimenopause, menopause, all of those things that only affect women. They've been very, very understudied, and so it makes it very difficult to find information. Sometimes it even makes it difficult to find a physician that is going to be able to answer your questions. And so I see that from patients. And then when we add on the other factor that you were mentioning around poverty, and it's important for us to talk about not just clinical factors, but social factors. In fact, 80% of clinical outcomes are due to social factors. 50% of your outcomes are related just to your zip code, just to your zip code. So we think about things like healthcare access. We think about access to childcare. We think about access to transportation. And if I had to say which social driver of health I think is the most determinant, I would say economic instability. If you don't have money, you don't have choice. You don't have choice of where you live. You don't have choice of what your family is exposed to. You don't have choice of what you eat. And so all of those things I think are very important, especially when we're talking about in New Orleans, and wanting to make sure that all of our citizens have good outcomes, regardless if you live on St. Charles or if you live somewhere else, that want to make sure that everybody has good outcomes regardless of your zip code. And that is where public policy comes in. As you mentioned, when some of the work that we've done, when you think about when outcomes are the worst, especially for moms, it's not during delivery, it's after delivery and up to 1 year postpartum. Think about, for those women in the audience who have delivered a baby or you've supported someone that's delivered a baby, think about how healthcare happens. You deliver your baby, you go home, you don't see a doctor for 6 weeks, right? You definitely don't usually see a doctor after that 6-week time frame. What if you're a patient that also doesn't have insurance? Now you don't even have access to see someone in what is the most vulnerable time. And so now, because of the work that we've done, women in Louisiana do have access. And this is just an example of how you use public policy to actually help improve outcomes, our health outcomes.
And you mentioned No Care, the first 6 weeks. I think that we actually have some programs in the city that do go into the home, which, like you said, no transportation, no childcare, which universal free childcare would solve, I think, all of our country's problems.
Yes. Yes.
You know, we have something we've started here, and can you talk just a little about, before I go to the next question, how you've seen the changes in new mothers now that someone's able to go into their home?
Yes, and so just to expand on that a little bit, we are the only high-income country that does not offer at least one postpartum visit in the home. The only high-income country that doesn't. But because of Family Connects, and I know you're also on the board, because of Family Connects, we are now providing that to our moms in New Orleans. It's a pilot program at Ochsner Baptist and at Touro, where those moms are having someone to come into the house to not only check on them, but to also check on their baby. And not just check on them and say, hey, how you doing? But to do actual exams, to do screening for postpartum depression, to do all of those, to look at those things and those factors that we know can impact their outcomes. And we are seeing improved outcomes because of that. And we have also advocated that that be a policy that is available not just to people in New Orleans, but all over Louisiana, because we are seeing those outcomes improve.
Good. It's a great program. Great program. Dr. Davis, building on that, since I know you spend a lot of your career, as I see here, looking at reducing disparities in health outcomes and promoting health equity, building on Dr. Gillespie, how have you been working on that beyond just new mothers, the barriers you've faced, I'm sure many, and what actually got through?
Well, thank you for the question, and thank you for having me here. As we think about providing equity and equitable health care to women and to all of our residents of the city of New Orleans, it's important for us to recognize and actually voice that the disparity that Dr. Gillespie Bell mentioned about zip codes is sobering and one that we have to directly address. So where we sit now, the Lakeview, Lakeshore, Lake Vista, the life expectancy for individuals who live in this area is 88 years of age. But where I work every day in New Orleans East, the life expectancy is 62 years of age. That's a 26-year difference that is not based in our genetic code, but as Dr. Gillespie said, in our zip codes. It is the systemic racism and disinvestment in areas in our city that we have to come to terms with. These are uncomfortable conversations to have, because when we start talking about equity and making sure that we're making systematic investments that the data leads us to, we start to feel like we might lose something. Hey, I like Lakeview. My son attends school at St. Paul's. I want to make sure, right, that we have all of the resources that we need. But that means that our community members that we called essential during COVID, that provide all of those cultural services that we love, that people come here to visit, are those who are suffering the most in Treme, in New Orleans East, in Central City, and they're dying from preventable diseases just because of where they have the unfortunate chance of living, working, playing, and going to school. So when we think about those disparities and what we can do from a policy standpoint, it's first to actually let the data dictate our policy. We know, looking at Charmaine, that when you're sitting on the front row, Charmaine, so you're gonna get called out, that the United Way's ALICE report, right? Hopefully everybody is aware of that report. If you aren't, you should be. ALICE stands for individuals who are asset limited, income constrained, but employed. They are our working poor. Sometimes these individuals are those who are working more than one job. 77% of single mothers are ALICE mothers. These are the mothers who are taking care of our children. It means that we have over half of our children in this area who are being raised in unstable economic situations. Dr. Gillespie just said to us, the most important factor for social determinants of health is that economic stability, because without that, you don't have choice. So when we think about policy, even for healthcare, it's how do we make sure that women have not just living wage paying jobs, but equal wage paying jobs. But how do we make sure that not just the city of New Orleans, which has led the way in having family leave policies, but that we force through shaming our public and private entities to making sure that we have maternal leave policies and family leave policies that allow our women to be able to take care of their families. And then it is intentional investment in infrastructure. Where I work in New Orleans East, we're 20 years out from Hurricane Katrina. We reimagined and brought back a hospital that has been a catalyst for economic development and workforce development. But that hospital took 10 years to rebuild. It's 50% smaller than the hospital that was there before. We fight for just equal investment in an area that has some of the highest rates of preventable health disorders. We are the city's only owned hospital, not New Orleans East's hospital. We are the city of New Orleans' hospital, but we have no line item funding from the city of New Orleans. You got to put your money where your mouth is. And if we are to invest in the places that need the most investment and really let our equity data, the zip code data, the ALICE data, lead us to having policies that will get us to better outcomes, then we have to start being comfortable with being uncomfortable, and wanting to invest in those areas more than those who already have plentiful resources.
So I know what your number one request is for the new mayor, which is a line
She knows
item
already.
for the hospital. So my follow-up to that is, first 100 days, what are you going to do with it?
So we've got a big plan out here that we've had for 5 years, right? If we just had a little money. But there are, again, looking at the data, in New Orleans East, the women in New Orleans East travel 3 times as far as anywhere else in the metropolitan area to seek maternity care. Here's an area where you have a high predominance of Black and brown women who have the 4 times rate compared to their white counterparts of dying during childbirth. These are the women who are delivering on the interstate because they have to drive 30 minutes, 3 times as far as anywhere else. So we have been fighting for more maternal fetal medicine services. We have had support from the state legislature and have brought a maternal fetal medicine clinic there, but we need more. So that's priority number 1. The second is that 20 years ago, prior to Hurricane Katrina, there were over 150 behavioral health beds in the New Orleans East area. Today, there are 0. When our behavioral health needs have grown, we have had so much trauma in our area, but there is nowhere for residents in New Orleans East to receive those services. So we are working feverishly, again, with the legislature. I'll actually be in Baton Rouge tomorrow, talking about how we get our state capital outlay funding to be redirected to behavioral health. So there are needs, and I speak personally about New Orleans East because that is where I work and play. But there are those needs all across the city of New Orleans. The data is there. The city has the community health improvement plan that Dr. Avegno uses as her Bible, and we are so grateful to her. But we need to let that data dictate where the investment goes.
Thank you. Appreciate that. Dr. Blanton, you're up next. And the open question for you is, tell us what you've been seeing from a reproductive standpoint, especially since 2022, the changes over time, how you've had to respond differently, and compared to the rest of your career. What are you feeling right now?
Thanks. To repeat some of the things Dr. Gillespie Bell says, I think one of our biggest problems is to get people access to care, and that includes all different types of care, and that's something that patients are becoming more and more anxious about. There's a lot of public policy changes that are happening or that are scheduled to happen that I think people are beginning to be very aware of, and that they're very anxious about how that's going to impact them. People come in and they're worried they're going to lose access to fully covered contraceptive care under the Affordable Care Act. There's a lot of people who have a lot of concerns about that, reasonably. Are they going to lose access to fully funded preventative medical care, again, under the Affordable Care Act? And that feels very vulnerable to people. People are worried about, the loss of the Medicaid expansion programs and Medicaid cuts and how that's going to impact them personally. I hear from a lot of patients that they're worried about, some of the upcoming legislation that's going to make them ineligible for Medicaid in a lot of different ways. And people are worried about what they're going to do, and I think it's changing how they feel about, really about how they feel about the community, how they feel about what they're going to make choices as far as reproductive care, what choices they're going to make for contraception, all of those things, and access to care I think is such a big issue, and we've done a better job of improving our outcomes during pregnancy, a lot of the work that the LAQPC has done, but we're still struggle so much with getting people access to care outside of pregnancy. Even if you extend that coverage for a year, which not everyone's eligible for, even if you extend that coverage for a year, 366 days, we have nothing to offer you, or prior to that first pregnancy, So we have women who come in with all sorts of major medical problems, and they don't have access to any type of care outside of that pregnancy. And sometimes we see these same folks back again for another pregnancy, and we've still been unable to really meet their needs and to solve those problems. We can get them into an obstetrician's office, but we can't necessarily get them the other specialty care that they need, and we can't get it for them, 18 months after they deliver or before they're ever pregnant. I think, one of the other things you mentioned that I would agree with a lot is a reliable source of information. Social media has become sort of a huge presence, and I have teenage children, so I know this personally. But social media is such a huge presence, and more, I think we're all spending a lot of time really trying to connect with patients and sort of deal with some of the fallout from the social media presence that they're hearing. And when we don't have good access to care for folks, and when they're limited in coming into the doctor, and we're not able to really make that relationship that we wish that we could, it makes it even harder to deal with the misinformation out there, whether that's about vaccines or menopause treatment or prenatal care, any number of things. Contraception lately has been sort of a dirty word on social media, oddly. And so much of this misinformation, I think, is costing people a lot of good time they could spend with their doctor addressing their needs, and they're really focusing on dealing with these problems. Yeah.
I feel like your response is a commentary on all of healthcare in America right now, like literally covering everything, the lack of access, the lack of understanding. I mean, preventative care and contraception could solve so many issues. I mean, and I see some of my colleagues have started to understand that a little, and I've heard them say, well, we can spend $1 now or $1,000 later. I said, let me tell you all the ways we can do this. But there are two things I wanted to ask you about. First is the contraception. Blowing my mind kind of that perhaps there's younger women who are scared of it. And then number two, you said there are people thinking of leaving because of care. I think that's what you said. Do you mean the city, the state?
I mean, for most people, that's the same choice. So they're leaving the area, going someplace else, particularly people who aren't as rooted. I think there's a lot of anxiety out there about, if, for example, I have a long-acting reversible contraceptive, which costs, $1,000 minimum to get that put in, and I'm going to need to get that replaced in a year or two, is that full coverage going to be there? If I have insurance, even if I have insurance, is that coverage going to be there? Most of us remember that it hasn't always been there, and that might be a vulnerable position. The same thing with preventative care, like mammograms and pap smears. Those things haven't always been fully funded, even for folks with insurance. I hope they always will be.
Right. I just did that recently. You're right. I mean, if my insurance was not paying for that mammogram, I would get it every 3 or 4 or 5 years probably, because that stuff is really expensive. It's always disheartening to hear when people are concerned about birth control, knowing if an accident or something happens, how it will affect them physically, mentally, financially, just like their entire future, when we could solve this pretty cheaply. But thank you for that. I'm going to move on to Erin. We're going to talk about mental health. We know that women and children in our city face a lot of unique traumas, anywhere from weather-related, I'll just say, financial. We had a terrorist attack early this year. I feel like there's always something going on here every time it rains. So can you talk a little bit about what you see that might be specific to New Orleans with women? I'm going to throw children in there too, because that's who's dealing with the trauma of children in this city, and how you think we might be able to better navigate that.
Yeah, are we on? Yeah. Thank you. Thanks for having me here. What an honor it is to be sitting with you ladies, by the way. Yes, I think my other fellow panelists have actually brought up a lot of great points that are the causes of a lot of this stress. When I was in grad school, it was time to select a specialty. And usually when I tell people infant mental health, they kind of look at me silly, like, what is that? I don't get what that is. And it came to me that the biggest place that where I could make the biggest impact in a human's life is within the first 3 years of life. And that actually starts with taking care of their mother and or their primary caregiver, whoever it is. There's a direct impact between infant development and brain development based off of maternal mental health. So that's been a big passion of mine. And when I heard about the Family Connects New Orleans program, my gut reaction was, how do I help? What do I do? And that's kind of the first step that I've seen in New Orleans, at least personally. I came here from Pittsburgh, Pennsylvania, and there were programs back then, now I'm talking 12, 13 years ago, that they were kind of already implementing some of these things in the homes, where we were doing home visits, and it wasn't based off of income at all. And so what we're seeing now too is, like you said, a lot of trauma, and that impacts people for years and years. As far as when it comes to advocacy, I don't think most people realize that not only is there barriers to access of care for the clients, but there's barriers for therapists to give care. And that's something that we're really struggling with, whether it is government-funded type of healthcare or even private commercial health care. There's a lot of barriers for us to either get things, covered, or I literally had a claim today that was denied because we're seeing somebody using telehealth and they don't want to pay for that, which eliminates a bunch of rural communities that don't have as many therapists. There's a therapist shortage here. We have about 4.6 million people who live in the state, and we have about 16,000 roughly master's level therapists with active licenses. Active license doesn't mean that you're actually practicing, however. For example, I'm running clinics now. I don't take new clients. I have an active license, so I count in that number, but that doesn't mean I'm taking clients. Due to the barriers and the denials and basically, chasing funding all the time, a lot of therapists end up going to private pay, which eliminates, like you said, now we're talking about the economic stability. So now we're seeing an entire group of people who can no longer afford care. So the ones that are, accepting insurance or accepting Medicaid are dwindling. So that's an issue that we're dealing with. And not only do we need to advocate for better reimbursement rates, but I don't think we should be fighting to have a diagnosis covered by health insurance. I have clinics also in Mississippi, and Mississippi Medicaid actually pays 47% higher than it does in Louisiana. Blue Cross Blue Shield pays 81% higher in Mississippi than they do Louisiana. These are some major payers. These are the highest payers that we see across the states. Yeah, I'm hearing some rumblings, wow, really? And I have a cousin who is a math teacher, and I had her double check my math on that to make sure that what I was saying is accurate, so thank you, Gina. So now what we're seeing is therapists who are licensed in Louisiana are now obtaining Mississippi licensure, and they can practice virtually and make more money over there. And so we're losing therapists as well. So not only is there we're struggling with access of care for clients, but the therapists are struggling as well. So that's where we are.
Well, thank you. I saw we're almost out of time, but I have to say mental health concerns are being talked about more and more and more, but funding isn't sent. I mean, every time
Correct.
there's a violent situation or something with a teenager in trouble, we need mental health care, and then they don't fund it. And so that seems to be a lot of the problem with that. But I am going to wrap up. I think what everything up here shows is how integral healthcare, especially for women, is to society. And I say that with a little hesitance. I really hate how women's healthcare gets put like a niche, like it's orthopedics or something. I mean, this is half of society who goes through a lot of trauma in their lives that the other half doesn't go through, and is taking care of the children at the same time. I mean, we can't have a healthy city or state or society if half of the people can't go to work or school or take care of their kids or do any of the above. And this is something we can work on in the city, and the council member described many of the things she's worked on along with fellow donor Dr. Avegno back there. And there's a lot more that we can do within the city just to improve this access. We maybe can't always address the amount of money, but we can improve the access there. And as a final plug, since we are here for someone who probably will be our next mayor. I'll say who will be our next mayor. I'll just go there. I'll just say that. It's something I want y'all to think about too, because I've been going through this 6 years. There's lip service, and then there's people who really do work on certain issues. And be careful of the lip service. And some of it is obvious, like anti-abortion politicians. You are clearly using women's bodies for votes, but it comes from all sides too. So if you're looking at a candidate who says, "I support this, that, and the other. I support women's reproductive care," tell me about it. What do you understand about it? And in a case over here, we have 20 years of work on women's health care, but as we lead into the next panel, how women's bodies get abused and how we have to work on that from the other end of the spectrum. So thank you, everyone. Our panelists were wonderful. And we're moving on to the second part of the program.
All right. Before everybody starts to get around and start, do we have cocktails back there? That's what, no, I'm just kidding. Just playing with y'all. All right, y'all, we have a really amazing panel coming up, and this really has to do with some of the urgent challenges that we continue to face around the issues of domestic violence and sexual assault. And all the panelists up here I'm so familiar with. You all are just amazing advocates and have been in this work for so long. So let me go ahead and first introduce the panel, and raise your hand as I introduce you. So first we have Mary Claire Landry. Mary Claire, raise your hand. So Mary Claire, I mean, you have been in this work for quite some time, for 47 years. As a clinical social worker with the Masters of Social Work from Tulane. You were the Director of Domestic Violence and Sexual Assault Services for Catholic Charities for the Archdiocese of New Orleans. And then in 2007, she created the New Orleans Family Justice Center, and she currently remains CEO as the Family Justice Center CEO, sorry, you're the CEO there, and also the Hope Community Health Center. Mary Claire, thank you for being with us. Morgan Lamondre, she is the CEO of Sexual Trauma Awareness and Response. We call it STAR, you call it STAR, and she is a tremendous advocate for victims of sexual assault. She is also someone who is always in Baton Rouge, writing legislation, working on policy, talking to legislators, and really pushing for better laws to protect victims of sexual assault. Thank you, Morgan, for being with us. Desiree Charbonnet. Desiree is a former municipal court judge, and that's actually how I got to know her, because of her work around the issues of domestic violence and also human trafficking as well. And actually, when we were working through some of our legislative items, Charmaine, so that I could understand the process more around temporary restraining orders, how those were applied, Desiree said, well, state rep, come and sit in my court and see how it's done. And I learned so much from back then, Judge Charbonnet, as to how the laws that we were putting together were being applied. And so I will never forget, you taking the time to do that, but it just goes to the level of not just obviously doing her job, but doing all possible to teach others about the impact of laws in our city and what's working and what's not. So Desiree Charbonnet, thanks for being with us. Ms. Trelva Wells. So Trelva, I have worked with for several years now. Trelva is a survivor of domestic violence. She'll tell a little bit of her story in just a bit. But what Trelva has been able to do is she has utilized her experience as a survivor to in turn now help other survivors navigate through the process. So that is her work and her job now, and she is the Vice President of Voices for the New Orleans Family Justice Center. Thank you, Trelva, for being with us. And last but certainly not least is my friend Misty Fry. Great to see you, Misty. Misty is an amazing advocate for the Family Justice Center, and she also is now doing the lethality assessments too when it comes to domestic violence cases, and also helping survivors really navigate through what needs to be done to protect themselves and protect their families as they're navigating through the criminal justice system. So Misty is our boots on the ground. She is our boots on the ground. And I appreciate all you do. And actually, Misty and Mary Claire, I'm going to start with you all, because I want you all to explain to all of us what you are seeing now in the city of New Orleans as far as domestic violence, and what you are seeing now as far as city support.
That's Corey. That's my husband and my daughter.
Hey, hey, Dr. Corey. Everybody say, hey, Dr. Corey.
I'm so sorry. I'm sorry.
Okay, that was awesome. That was awesome. Back to the panel. So explain to us what you're seeing in the city as far as the level of domestic violence that is being experienced. And then I also want you to talk about, too, loop it all into what you're seeing as far as city services being provided now.
Well, thank you, Helena. You have been just an amazing advocate for us. And I just want to thank you for all the legislative work that since 2014. And I can remember going to Helena's office with Charmaine and Kim, and Helena saying, well, you know, I think we better, you know, rethink about this and maybe just do parts of this. And I can remember Charmaine saying, nope, we're going for all of it. We're not backing down. And Helena was like, all right.
But you know why we didn't back down? And this is so important, and keep this in mind as we help support Representative Landry and what she's trying to accomplish. You know why I didn't back down? Because you all had my back.
Yes.
And because you all showed up every time, you had my back, and I wasn't fighting this fight alone, and that matters. So remember that, too, as we move forward through this next legislative session.
Amen. So as a response to domestic violence, I was running the domestic violence shelter for Catholic Charities, and when we came back, it was clear that we really needed a new model for how we were going to approach domestic violence, sexual assault, and human trafficking. And so the model that we embraced is the New Orleans Family Justice Center, which is bringing all of the service providers, all the multidisciplinary systems, both private and public, in one location so that it is not the survivor that has to navigate all these systems and go to all these different places and call all these numbers, but that she can come to one place, very easy, she can walk in, and there will be an advocate who will walk her through a whole process in terms of understanding what her needs are, what the pathways that she needs to stay safe, and what those issues are. And so I will say that this has been a transformational process for our city. We are now seeing 4,000 plus survivors walking into our facility every year. And I will say, and we have police on site, we have the civil legal providers on site, we have the district attorney's office, so it takes a whole village to be able to respond to these needs. And I will say that The city has been amazing. The state has been amazing. 20 years ago, when we were looking at this, we didn't get a penny from the city. And they have been just tremendous in innovative programming, new programming around advocacy and initiatives, and really making sure that we're connecting with victims as quickly and as preventively as possible. And that model, I think, is going to become a national model. So I thank Dr. Avegno for having that vision and having that support, and Helena and the whole city council in terms of that. I will say the one thing that I lose sleep on, and it's the reason I created the Hope Community Health Center, because in 2017, we began to do forensic exams, not only for sexual assault victims, but also for domestic violence and human trafficking. And we've been doing a lethality assessment, a validated tool that looks at all of the factors that make survivors unsafe and high risk for homicide. And one factor that continued to stand out was the question that asked, has anybody ever put their hands around your neck? Has anyone ever attempted to suffocate you? Has anyone ever used some other method to stop your breathing? And what we have found with thousands, I mean, like I said, this has been since 2013, we've been tracking this. And no matter how many thousands of survivors that we see that walk through the door every year, the answer to that question has consistently been between 60 and 65%. Now that is really concerning to me, and it is the thing that makes me lose sleep. And I guess for me, and why I created the Hope Clinic, is for that access, so that they come in, they can get a forensic exam, they can understand what strangulation is, because they think it's choking, and they've normalized it, and we've normalized it in some ways in our country, which is very concerning, especially for young college students who oftentimes include this in their sexual relationships. So we should be very concerned about this, and we should have a media splits about how dangerous strangulation can be. And I just want to say that oftentimes survivors stay in relationships with perpetrators is because of the financial and economic realities that they are facing, because they don't have the economic pathways to move out of a relationship that's not safe. And I just think we need to really think, is that what a heavy price these women are bearing? Possible brain injury, possible concussion, possible long-term medical impacts from strangulation. And it's not just one incident, it's many incidents over and over and over again. And so that's why I am so committed to the Hope Community Center, who is helping us to identify the forensics around that and helping us to really give survivors pathways and housing and resources so that they don't have to rely on getting their heads beat down, because this is the only way that they can survive financially. So I just want to say that, and I could go on and on, and I know I
you're
can't.
good. You're good, Mary Claire. But you know, you're talking about the obviously strangulation, and the reason why this is such an important factor to consider, and why the City Council pushed the district attorney to ensure that there are now Gwen's Law hearings for strangulation cases, which is really a risk assessment hearing to determine how long the offender is going to be held with bond, is because strangulation is one of the factors where it now increases the possibility that the victim could be killed. And so that takes me over to Misty. Misty, you are now, have a very important role as far as dealing directly with survivors.
Hopefully will replace me.
Misty's amazing. Misty is amazing. We love you, Mary Claire, and Misty is amazing. Yes, but I want to know exactly, Misty, what are you seeing in the city of New Orleans? Is the violence going? Is it getting worse? Is it getting better? What are you seeing?
Okay, Councilman, Member Helena, I'm sorry. I have to say this, and I'm gonna be very transparent. Given the times that we're in, and because of the economy and the communities that we have, times are hard for families, right? And it's getting harder. Making that decision to leave is not an easy decision to leave. But when you find yourself in a situation where you're, like Mary Claire said, getting your head banged in, or you being strangled, possibly threatened to be killed, and you want to leave, but the finances are not there, or let's say you do leave and you do have a job, but your job don't even work with you to give you time to take care of your needs for you and your family. It takes a community being educated and understanding the dynamics of domestic violence and sexual assault, strangulation, child abuse, family violence, how it all goes together. I cannot be beaten, strangled, and still expected to show up to work tomorrow morning like nothing has happened. And we have to start there. We have to continue to educate. I hear it from our survivors. I'm sitting there with them. My staff, some of them are here tonight. They're sitting there with them. Jobs, people don't understand. They need a moment. They need time. They have to revamp to figure things out. When we put those type of pressures on survivors, then we are actually adding to the issue and to the problem that we may be also sending them back to a situation to die. Because we're not educating as a community overall. What does that mean? Every single place of employment here needs to understand how domestic violence is a public health crisis. Yes.
I'm going to start transitioning into also the difficulties of kind of navigating through the system when you are trying to actually get help and go through the criminal justice system and move away from that situation, which I also need to make sure everyone understands. By the time a victim has the courage to call police, so much has happened. And what I have always been so frustrated about is just kind of the aside from our district attorney, aside from obviously former Judge Charbonnet, but so often the criminal justice system just dismisses domestic violence, doesn't treat it with the severity that it is. I hear often from even some who are in judicial seats, not just in New Orleans, but in other parts of the state, that, well, she's just going to go back to him. So what's the real point of, really dealing with trying to figure out what's really going on in this household? And so that to me has been so frustrating that we are able to pass very strong laws, but then when it comes to the criminal justice system really applying these laws, it's not happening. And so that takes me to Trelva. You had obviously an unreal situation happen to you, and you made it through and you survived. Tell us the difficulties that you faced as you tried to navigate through the criminal justice system, and then what advice are you giving to victims now to help them through the process? Because you know so clearly of what you faced.
Well, the difficulty with the system is they tell you it's not your trial. They tell you that it's the person who actually committed the crime, it's their trial. So you have to basically live by their rules. It wasn't even a good week before I was even out the hospital, and I already had to be summoned to court. And that way I have to sit in a room, not even 5 feet away from the person who just tried to kill me. I was paralyzed from the neck down. So I had 14 surgeries while I was in the hospital. So I spent almost 2 months in the hospital just to learn the basic. I had to learn how to brush my teeth, just take a bath, just sit up, just the basic before I can come home. So I've had all this trauma in the hospital. So now I come home and I get a summons to say, you have to be to court next week. Well, I'm still processing what happened. I'm still trying to get together what happened, what I done been through, the hell I done been through in this hospital, the surgeries I went through, the physical therapy. I'm trying to get through all of that. Now you telling me I have to sit in the room with him getting ready to walk in here? And like I say, I'm in the wheelchair, I'm wheelchair bound at this point. So I'm sitting in the courtroom and he walks in. What you think my reaction is? I'm screaming, I'm crying, I am all over the place in this courtroom, to the point where the police officer and my lawyer had to take me out. I was hyperventilating. So they gave me a minute, but I still had to go back in, and I don't think that's fair. I don't think that's fair that I had to go see him that fast. I feel like I said, I wasn't protected. I feel like I wasn't heard, I wasn't seen. It was like I was forced to do something and I wasn't ready. So that's the only advice I would give. Give us some time. Give us some time to cope with what happened before you make us go look at the person who just tried to treat us like dirt.
Can I also add, because I know your story, the level of intimidation that you also faced from him and also from his family members?
His family is well known in New Orleans. So the minute I hit the hospital, they were calling the hospital. They were looking for me. It was so bad, I had to be put under an alias name. They were calling and calling, then they started coming to the hospital. So I had to have police outside my door, round the clock, just so they couldn't get to my room. I only had to have like 3 or 4 nurses. Those same nurses had to check in and out. The same ones, they couldn't rotate. They had to have the same nurses in and out, and that was the nurses that was assigned to me. But like I said, I had to have literally police at the door, and if I had to go to surgery, usually the surgeons don't come up to the room. I had the head surgeons coming up to the room, the nurses, everybody had to be checked in before I can go get surgery. And I had to be escorted. We didn't go to surgery like everybody else go through surgery. We went down back ways and tunnels. It's back of the hospitals I thought I've never seen before. But that's how I had to go to surgery, and that's how I had to come back. And then when we come back, everybody had to be checked, and that's just how it was.
You have come such a long way. You have made it through. And I've talked to you about this, and I know that we've talked about your faith and the fact that you pulled through and you survived for your son. And she has a wonderful son. And so now you're helping others. Tell me what that work has been like for you.
It's fulfilling, it's rewarding, but it's scary at the same time because I'm still dealing with my own trauma. Even though it's been since 2016, I still have my moments. I still, because it happened at the house that I live in. Yeah. The same house I'm in today, that's where it happened at. So every now and then, I could be walking down my hallway and I can hear it. I could be washing clothes and I can hear it. I can go in my bedroom and I can hear it. Till this day, since 2016, I don't even sleep in my bedroom. I got me a little sofa bed, a little recliner, and I'll sleep in the living room or whatever room I'm in. But only thing I go in my room for is to take a bath and change clothes, and I'm back out of there. Because that's where the rape happened at. That's where this man strangled me at. That's where he tried to take my life at, in my room. So in my mind, I can't sleep in there, but I can't sell my house at the same time. It's not that easy.
Right. Well, we just love you and thank you for all that you're doing. You're amazing. We've talked a lot about domestic violence. Now I want to talk about also what we're seeing as far as sexual assault. And that's when I bring in Morgan Lamondre, who is such a tremendous advocate, and STAR does so much. You've helped so many people. Overwhelmingly, you've helped so many women. Tell me about what you are seeing in the city of New Orleans and really challenges that you're seeing in the city of New Orleans. I know that particularly when it comes to an OPD, no doubt we need to do much better on how we respond to someone who has been sexually assaulted and having quicker response times, and I have some ideas around that. But really, tell me what you're seeing.
So first I want to say thank you for being really the first elected official who understood there was a difference between domestic violence and sexual assault, because yes, that does deserve applause. Because although sexual assault can occur in an intimate relationship, which is a form of domestic violence, sexual assault in general does happen outside of that realm. And whenever we'd go to the Capitol and say, well, yeah, you're giving some funding to domestic violence, but not sexual assault. And they're like, but yes, we're funding this. No, you're not, So I appreciate you starting the conversations about we need resources for both, we need laws and protections for both. So I just wanted to throw that out there first. But I think that there are just very significant challenges, in particular in the area about clearance rates. In terms of intervening, one, as a whole in Louisiana, to have like true prevention, we tend to think prevention is focusing on potential victims rather than focusing on potential offenders. What that means is we really, at a state level, need comprehensive sex education. How can you teach what consent is and what not to do if we're not even teaching people the proper terminology for their body parts, first of all? So, but as it relates to in the city, I think that there's been constant attempts by the city council to, whether it's, civilian personnel to do some of these investigations, we're still seeing just gaps in responses. And I think that what it boils down to is the community has lost trust in the response, whether it's 911 calls, like going unanswered or just, so few people are getting, their cases are being cleared. I think right now we might be at a 3.3% or so clearance rate for sexual assault. So when it comes to, we tell people, we want you to report, we want you to, go through what we're calling the criminal justice system. It's not justice. It's a criminal legal system, but there's anything but justice, especially when you go through that system and you become more traumatized by the system than sometimes the original offense. So I think, what we're seeing in New Orleans in particular is people are no longer coming to us with any thought that reporting is even part of their healing journey. And that's sad, because what we're seeing is, it's not that there's so many perpetrators of sexual assault out there. What we're seeing is the same perpetrators committing offenses over and over again because our systems are failing to hold them accountable. So what motivation is there for survivors to put themselves through a daunting, traumatizing process? And to kind of piggyback off of what you're saying, like, just because somebody for a moment says, like, this just happened, I need some breathing room, that doesn't mean that they're not wanting to be engaged in the system. What it does mean is they need resources, they need advocacy, they need all of the systems at play to be able to feel safe to go through that system. Let's give them a minute to catch their breath before forcing them into this just traumatizing experience. And then people aren't showing up to court. Like, we're making survivors go to court when they don't really truly need to be there. And I think that, when it comes down to it, we have to look at justice for survivors being more than jail. And justice can come in many forms, but if we really truly want to hold offenders accountable, we need law enforcement to really, take investigations seriously. It's not just about DNA. It's not just about one piece of the puzzle. We need comprehensive, trauma-informed investigations and meet survivors where they're at. So.
Thank you, Morgan, and you're leading in perfectly into, and I got it 5 minutes, to our former judge, Desiree Charbonnet, who, as I said, really understood how serious these issues are and worked with victims and trusted women. And so I guess my question to you is, how do we convince others to take sexual assault, to take domestic violence seriously, to understand that this type of trauma that's happening within our city is really impacting our entire city as a whole? And when we see domestic violence happening in a home, that spills out into our communities. And so that's why it has to be taken so seriously, that it isn't something that is just somebody else's problem or something within the family, or it isn't something that it's shameful and shouldn't be talked about. How do we start to turn this around so that we really have this understanding of how serious this really is?
Well, we have to have support for those who are enduring domestic violence. That is a huge, huge issue. I cannot tell you how many protective orders I have signed in my lifetime on the bench and have gone over those protective orders and said, and I'm going to just use the male as the abuser because 90% were. Pardon me, fellas. Some women were abusers, don't get me wrong. But, sir, do you understand that I'm placing you under a protective order? You cannot go within 100 yards of the victim. You cannot go to her school. You cannot go to her place of employment. You cannot contact her directly. You cannot contact her through a third party. Don't call her cousin to try to get a message to her, to threaten her, to tell her to drop the charges. So then I get to the bottom of the line, and this is when Helena contacted me, and I believe this is what we talked about. There's a portion of this protective order that says, you are hereby prohibited from possessing a firearm. So, and that's great, but there's nothing in place to make sure they no longer possess the firearm. So when I go through this order, in condition of your release from jail is that you post a bond and that you sign this protective order. I worried after every one I signed because I worried if the next person was going to be another victim of a horrendous attack. And what happens in domestic violence, and to answer your question is, because we don't have enough support and advocacy for the victims, you don't know about it. People don't report it. They keep it quiet. And so, and if they think that the system fails them, then why bother? But, I would go through that and then I would say, you can't have that gun in your home now, so you've got to give it to someone else. Or I had no way of making sure that individual no longer possessed. I couldn't tell them they couldn't own it. You cannot possess it as long as you're under this protective order. But the hard part, and this goes back to the support for the victims, is that financial dependence on your abuser it causes you to be weak. Yes. I have had women come into my courtroom who I have read the report. I know what happened to them. Well, I guess you should say allegedly, but some people have a pattern of behavior. So, and they'll walk up and say, Judge, I need to dismiss the charges. I'm like, ma'am, you're not set for court today. This is kind of not how it works. And miss, my lights are gonna be turned off, and me and my children are gonna be in the house with no lights. We're gonna get evicted, and I need him out of jail because I can't pay for it. So what do first of all, I'm not the one to dismiss the charges. Only the DA can dismiss the charges. The best I could do for her was reduce his bond so he can get, but I'm not doing that because I'm not his advocate. Now, I'm not supposed to be her advocate either, but I'll leave it there. I had to make sure I was ensuring the protection of the victims. And when you're weak, you're beat. When you're weak, you have nowhere else to go. You get back into that same routine, that same system. And you are right, Helena, by the time they've called the police, they've gotten some whippings. And this is the point at which they finally can't take it, or they think this might be the night he kills me, so I've got to call the police. Now, I'm just going to add this because I know time is short. Domestic violence is a scourge. It affects the woman in terms of, as we talked about, their physical health, right? There's bruises, there's strangulation, there's broken bones, there's pulling people down the stairway by their hair. But there are children involved, and there are children who see this. And that is the worst part. And there are women who's had to come to court because they didn't have anybody to watch their children, and they'd bring their kids. And because we didn't have anything set up to really handle this, I'd have to have my clerk, I'd say, okay, you get the kids and take them in the back office and let them go sit on my sofa, because I don't want them seeing this. They should be seeing this kind of thing. They've already seen their mom, you know, being attacked. And so there is this whole component, and as you can see, everyone up here has told you some different aspect of this. It is very real. And if we don't have enough support and advocacy, and I'm not saying there's not good work being done, but there's only so much work that is being done right now, and that's constrained by finances. But, you know, when you feel like you are at wit's end and you can do nothing without this man back in the house, you're ready to drop the charges. And so we'd have to have a hearing, you know, the DA. Listen, if you're not going to go forward with the charges, the DA can't prove his case against him. If you're not going to testify, if you're going to then change your story and say, well, you know, it wasn't that bad. It was a misunderstanding. You know, and so then the charges end up getting dismissed because you are your own witness. Yes. Unless someone else witnessed it, the DA can't move forward if you don't testify that it happened. And so charges get dropped a lot, and I'm not saying that as a dispersion to the district attorney, the prosecutorial arm of the government, but it's just because it's hard. It's hard to go all the way. Yeah. It's hard, but you know, we can always, I'm here to work on that with you, Madam Mayor, and I am going to go off script for a moment and say, this woman is running for mayor, and I know exactly what she's going through. It is a sacrifice like no other. And I'm gonna take this moment. I'm gonna take this moment as someone who ran and lost, and in my mind, it meant it was not for me at the time, and I am okay, and I've resolved myself to that many, many years ago. But what I do know is how damn hard this is. I do know how much she's being attacked. Yes. I know her integrity is being challenged, yes. And we know this woman, and we know who she is, and that is why we're with her. So it is up to us. It's us. It's important that we know what she stands for so that when it's time, we can defend her against the attacks, because she can't fight them off all on her own. She goes from morning to night. She's been going since 8 a.m., right? Oh, early. And I know how you feel. So my point is, when she gets tired and she gets weak, we have to lift her up. That's right. All right? I know that's not what you asked me to talk about, but we have no more opportunities to get it wrong this time, y'all. We can ill afford to not elect this woman. We have got to get her in this office. So not only do we have the issues, not only do we have to deal with the issues, and I know that once she's there, she'll do everything she can in her power to address the issues we've talked about here on this panel and the doctors before us. But can't do anything if we don't get her in there, y'all. We gotta vote for her, we gotta work for her. I'm closing on that. Helena Moreno, 2 words.
Okay, so now y'all are overwhelming me. First, thank you to this panel and Desi for your friendship. And, you know, she's right. I mean, certainly, you know, this has been quite the journey. And you all know that I took so seriously this decision to run for mayor. And, you know, at one point I said, it's like I certainly feel the weight on my shoulders of what's to come when I become mayor. And I had somebody tell me, it's not weight that you're feeling. We want you to feel us, the people of the city, lifting you up. And so you all are proving that right now tonight. Thank you so much to this panel. Thank you for all the work that you do. Let me bring Mandy Landry back up to close us out. Thank you all so much for coming. Remember, early voting is September 27th. Get out there and early vote. And Election Day is October 11th.
Thank you. I will close us out from these two amazing panels quickly. These are some solid people you out here. Thanks to Todd, and I love the irony of a man putting this all together for us. I really, he was amazing. Obviously, Angela's in charge of everything all the time. So we really appreciate it, but two quick comments. One thing I wanted to mention, our friends who are trans, who often have physical and mental health issues similar to us in this room, but also, as Morgan can attest to, suffer severe levels of sexual assault. So just wanted to throw that out there. But all this shows, come on, when you're a candidate, you're attacked from all angles as a woman. When you get into office, you are under a microscope. And that's why we need strong people. We have a judge here. We have a CEO of a hospital over there. And to have a woman like Helena, whatever, Helena. Lots of nicknames for you lately. Lots of nicknames. To have a woman like Helena, who has worked on these issues for so many years, to be the mayor of a major American city, when we really, really need someone, especially for women and children in this city, is something we need to grab. And I can't wait to see what happens in the next 4 years. And I think we have Morgan who's going to close us out.
Hello, everyone. I'm Morgan Walker with the Young Leaders from Moreno. A few things before everyone leave. I want to say what a wonderful panel. You guys did amazing tonight. And before you leave, I just want to point out a few quick dates. Early voting happens Saturday, September 27th through Saturday, October 4th. And then we have Election Day, October 11th. And also, please, 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 if you guys can meet us at the headquarters and sign up and grab your yard signs to really, really get the word out to early vote for Helena Moreno. That's what we're doing. So I just wanted to say that, and thank you guys, and let's go.
And Angela will kill me if I don't go through my thank you list. Hang on. First, thank you to the Lake House. And thank you to the Lake House. Thank you to, of course, State Rep Mandy Landry. To all the panelists, to my council staff, if they're still here. Sheree, what's up? Hey, Sheree. To all my campaign volunteers, to my campaign team. Oh, one thing I should mention, by the way, did y'all know that my entire council staff, except for my executive security, all my council staff, they're all women. Yeah. And it wasn't anything that I meant to do. It was just that I happened to hire the most talented people, and they're all women. And then, as y'all know, my campaign manager, Renee Laperoulari, strong woman. And if we win, or maybe I should say, when we win, this would have been the first, from what I understand, the first winning mayoral campaign led by a woman, with a woman campaign manager. So let's get it done. Thank y'all so much for coming. And thank you to Jason Berry. Appreciate you.